everyone. Today we are here to discuss on one of the rising concern across the globe, that is prematurity births. Nowadays, preterm birth is a significant public health problem across the world today. Preterm births are highly common globally. About 15 million babies are born prematurely around the world every year. That is, more than 1 in 10 of all babies are premature. Almost 1 million children die each year due to complications associated with preterm birth. As per WHO, preterm is defined as babies born alive before 37 weeks of gestation or fewer than 259 days of gestation since the first day of a woman's last menstrual period. There are three subcategories of preterm birth based on gestational age. Extremely preterm, which is less than 28 weeks, very preterm 28 to less than 32 weeks, moderate to late preterm 32 to less than 37 weeks. Preterm birth may have variety of causes which include infections and chronic conditions such as diabetes and high blood pressure, spontaneous preterm birth after spontaneous onset of labor or following pre-labor premature rupture of membranes, genetic influences and multiple pregnancies such as twins and triplets. Excessive physical work or long time spent standing is also known to increase a woman's risk of preterm birth. Undernutrition, obesity, micronutrient deficiencies are some other risk factors as well. In most cases, preterm labor begins unexpectedly and the cause is unknown. Like regular labor, signs of early labor include a significant increase in the amount of discharge or leaking fluid or bleeding from the vagina, contractions where the abdomen tightens like a fist every 10 minutes, abdominal cramps with or without diarrhea are also observed, low, dull backache and cramps that feel like a menstrual period, pelvic pressure is observed with a feeling that the baby is pushing down. To date, there is no single test or sequence of assessment measures to accurately predict preterm birth. Clinical, biophysical, and biochemical tests that can be used as predictors for preterm birth include initial identification of clinical risk factors where symptoms like pelvic pressure, increased vaginal discharge, or change in vaginal discharge, backache, and menstrual-like cramps are examined. Uterine contraction monitoring is done. Cervical examination, sonographic evaluation, etc. are also done. Cardiorespiratory monitoring, blood test, echocardiogram, and ultrasound scan are also performed if required. Because premature babies are not fully developed, they may suffer from various complications such as jaundice, brain injury, retinopathy, feeding difficulties, necrotizing enterocolitis, respiratory distress syndrome, and anemia of prematurity. Preterm babies may have various associated disabilities related to learning, hearing, respiratory disease, behavioral problems, and vision through childhood. Motor and cognitive delays are also commonly seen in them. Management of preterm birth incorporates specialized care of women during pregnancy and childbirth along with care of newborn baby. Care during pregnancy and childbirth includes use of antenatal corticosteroids, use of antibiotics for pre-labor premature rupture of membranes, and use of magnesium sulfate to women at risk of preterm birth before 32 weeks of gestation. Special care for newborn includes keeping the baby warm as preterm babies lose body heat more easily, which may result in hypothermia. Breathing as the lungs of preterm babies are underdeveloped and lack surfactant. Also, preterm babies may need additional support of feeding as the coordinated suck and swallow reflux is not fully developed. Babies who have additional complications may need to be kept in neonatal intensive care units. Also, kangaroo mother care, a technique by which the baby is held on an adult's chest, usually the mother, with skin-to-skin contact for extended period of time can be helpful. Preterm delivery now affects up to 1 out of every 8 infants born. Yet, this issue receives far less systemic attention than do conditions occurring much more infrequently. Thus, identifying risk factors is crucial, and prevention and management can be effective in reduction of preterm births. This was a brief overview about preterm birth. Let us know how did you find it by commenting below. Tell us what else you would like to hear from us.